Well, I'm joined now by Kieron Boyle, Chief Executive of Guy's and St Thomas's Charity. Very well welcome. Thank you very much for coming into the studio. So tell me a bit more about your charity and your place-based strategy for dealing with health issues.
So we're the country's largest place-based foundation, and we think place is a really interesting way of understanding the complexity of people's health. So how do you really get under the skin of everyday experience of health? But place for us means three things. So we work in a physical place, which is Lambeth and Southwark in South London. We work in a type of place, so places that are densely populated, they're culturally and ethnically really diverse, and they have high levels of income inequality. But a really crucial bit about place for us is the context of place. So why is it that some streets feel like they're for people or not? Why do people feel like some public services they can use or they can't? And we really try and understand that sort of thing.
What are the kind of issues that you deal with in those places?
Yeah. So we focus on issues like childhood obesity or people living with multiple long-term conditions. And the reason that we do is that different communities experience very, very different outcomes on those. So for example, children in some of the poorest areas of where we live are 2 to 3 times more likely to be obese than children in richer areas. And our place focus is to take a really hyper-local approach. So by that what we mean is we focus on neighbourhoods, perhaps even kind of 500 metres, and say, well, in that 500 metres, can you layer up a lot of different things that can help with every aspect of that complex issue? To give an example, we do a lot of work in a place called Faraday. There's a very old street market there, a food market. And what we've done is we partnered with 6 or 7 different organisations that are helping kids think about, well, healthy eating, helping their families think about cooking, thinking about physical activity. So all of that's great, but what if a family can't afford to buy healthy food? So one of the charities that we partnered with there is called Alexander Rose, and what they do is they give food vouchers to lower income families, and those families can go to the local market and use those vouchers to buy healthy food.
As you said, it's about partnership and collaboration, and that's what ultimately has an impact on long-term conditions as well.
Exactly, it's all about partnerships, and there's a really important shift going on from funders like us to moving to how do we build much more active partnerships with people rather than just giving grants. The interesting thing about working in a place is just how wide those partnerships have to be. So it might be with the NHS, so for example we work with the local hospital around community nursing. It might be with big businesses, so we're working with every single major supermarket in the areas that we work to see if they can promote healthier food to families. And what we're finding from those partnerships is it's almost that 3 different types of impact occur. So there's the impact of the projects themselves, then there's the impact that they're quite complementary, you know, they're helping each other with different things. But the third one's the most interesting, which is that they're all learning from one another about what it takes to be effective in that place, in that location. And
I'm assuming part of that learning is how to engage the different communities that you deal with.
Yeah, absolutely. So sometimes places are kind of a really, really local thing, but take Lambeth. 1 in 6 people in Lambeth speak Portuguese. So it's a really important community to engage with, and particularly because they have more long-term conditions than the average. Now, there's not one place you can go to engage this community, but there are lots of different places. So for example, we engage with local football clubs, because it's a really good way to engage the Portuguese community.
Well, we really look forward to following your progress and wish you the very best of luck. Thank you very much indeed.
Thank you.